Welcome to this introductory video discussing the fundamentals of mental health. Before we begin, it's important to note that Shared Health provides health services in facilities located on the treaty territories and ancestral lands of the Inuit, Anishinabeg, Anishinaabe, Nahitawuk, Ininawak, Nehiawak, Dakota Oyate, and Denisoline nations, and on the national homeland of the Red River Métis. We acknowledge harms caused by colonialism and dedicate ourselves to building relationships and collaborating with First Nations, Inuit, and Métis people. Through this commitment, and rooted in truth and reconciliation, we will improve health experiences and outcomes for Indigenous people. This video will introduce the following topics: components of health and mental health, factors impacting our mental health knowledge, relationships between mental health and substance use, mental health promotion, risk factors, treatment options and finding support, mental health and addictions, involvement of family and friends, empathy and recovery, resources, and finding help. It is okay if you are not familiar with these topics right now, as we will discuss them further in the video. After viewing this video, you will be able to define mental health and recognize the impact of mental health challenges when substance use is involved, understand the significance of stigmas and myths surrounding mental health, become familiar with common mental health disorders and co-occurring disorders, develop an understanding of mental health treatments and recovery supports, and to have a greater awareness of mental health resources available. Before we can talk about mental health, it can be helpful to start with what the word health means. We use the term health on a regular basis, but we would all likely describe it differently. Most people tend to focus on their physical health. How are they feeling in terms of their physical fitness, their heart, lungs, and muscles? The World Health Organization definition of health has not changed since 1948, and yes, it includes physical health, but it also includes our mental and social health. What are those pieces? What do they mean? Being healthy is not just about the absence of illness. Our health can change and is impacted by many things. The definition of mental health is a bit more complex. It can include our thoughts, feelings, and emotions, and how we are connected to other things such as our culture and community. This may be the social health that was mentioned previously. Social health includes having a sense of connection to someone or something and having a sense of belonging in the world. It may be helpful to think of our mental health as falling along a scale that changes rather than staying the same all the time. Our mental health can shift depending on the situation we are facing. This is known as the mental health continuum. Think about your own life. There may be times when you feel healthy, you're sleeping well, feel you have the energy to do the things you would like to do throughout the day. There may be times when you feel anxiety, have aches and pains, or avoid public situations you would usually enjoy. These types of feelings and behaviors can be signs of how our mental health is currently functioning. It can be difficult to know when someone may be going through a normal experience versus having difficulty with their mental health, and when to reach out for support to a friend, leader, support person, or mental health professional. By normalizing conversations about mental health, we gain opportunities to connect with others, access supports, and improve our mental health knowledge. Many people are not well informed about mental health. It may not be something that they learned about in school. They might not have any experiences with someone who has a mental health challenge. There are many myths and stigmas surrounding mental health. We may not realize that these myths may make us have judgments and fears about people who experience mental health problems. When a person feels fear and shame about their own mental health issues, this is called self-stigma. These feelings can create a barrier to seeking help. Myth number 1. Mental illnesses aren't real illnesses. Fact: the words we use to describe mental illnesses have changed greatly over time. What hasn't changed is the fact that mental illnesses are not the regular ups and downs of life. Mental illnesses create distress, don't go away on their own, and are real health problems with effective treatments. When someone breaks their arm, we wouldn't expect them to just get over it, nor would we blame them if they needed a cast, sling, or other help in their daily life while they recovered. Myth number 2. People with mental illnesses are violent and dangerous. Fact: some people try to predict violence so they know what to avoid. However, the causes of violence are complicated. Researchers agree that mental illnesses are not a good predictor of violence. In fact, if we look at mental illnesses on their own, people who experience a mental illness are no more violent than people without a mental illness. It's also important to note that people who experience mental illnesses are much more likely to be victims of violence than to be violent. Myth number 3. People don't recover from mental illnesses. Fact, people can and do recover from mental illnesses. Today, there are many different kinds of treatments, services, and supports that can help. The fact is, people who experience mental illnesses can and do lead productive, engaged lives. They work, volunteer, or contribute their unique skills and abilities to their communities. Even when people experience mental illnesses that last for a long time, they can learn how to manage their symptoms so they can get back to their goals. If someone continues to experience many challenges, it may be a sign that different approaches or supports are needed. Myth number 4. People who experience mental illnesses are weak and can't handle stress. Fact, stress impacts well-being, but this is true for everyone. Many people who experience mental illnesses learn skills like stress management and problem solving so they can take care of stress before it affects their well-being. Taking care of yourself and asking for help when you need it are signs of strength, not weakness. Myth number 5. Mental illnesses are just an excuse for poor behavior. Fact, it's true that some people who experience mental illnesses may act in ways that are unexpected or seem strange to others. We need to remember that the illness, not the person, is behind these behaviors. No one chooses to experience a mental illness. People who experience a change in their behavior due to a mental illness may feel extremely embarrassed or ashamed around others. Let's look more at the impact these myths can have on the stigma related to mental health issues. Stigma can be described as a negative or unfavorable attitude towards something or someone. The Mental Health Commission of Canada states that stigma often results in fear, stereotyping, labeling, and making judgments about someone due to their mental health issue. We would never shame, blame, or make fun of someone who is diagnosed with a physical health issue, so why do we do it when someone has a mental health challenge? Stigma can be a barrier preventing people from talking about their experiences casually with friends and family or seeking out a professional to speak to. People may blame themselves for having a mental health issue. They may feel that they are weak or that they have done something to bring on these experiences. These are things that we can all do to reduce stigma. The Center for Addiction and Mental Health encourages us to know the facts, educate yourself about mental illness, including substance use disorders. Be aware of your attitudes and behavior. Examine your own thoughts, which can be impacted by your experiences, community, and the media. Choose your words carefully. The way we speak can affect the attitudes of others. Educate others. Pass on facts and positive attitudes. Challenge myths and stereotypes. Focus on the positive. Living with a mental illness or co-occurring disorder does not mean that there are limits to what someone can achieve and experience in their life. Support people. Treat everyone with dignity and respect. Offer support and encouragement. Include everyone. It's against the law to deny jobs or services to anyone with any health issue. There are various terms used to describe a situation when someone may be experiencing difficulty with their mental health. We might hear someone talking about being stressed out, feeling overwhelmed, having a nervous breakdown, or having difficulty keeping up at work or at school. It can be difficult to know what words to use to describe what someone may be going through. The terms mental health problem, mental health concern, mental health challenge, mental health difficulty, or mental illness may be used. Many people may think the terms mental health and mental illness are the same thing, when really they mean different things. Mental health problem is a more general term used, while mental illness is a more clinical term for when someone has been diagnosed with a mental illness by a professional. The language we use when referring to people who have mental health challenges is very important. There are many terms that are still used regularly today that are hurtful, offensive, and add to the stigma that people face. Having a greater awareness of the language we use can be helpful in choosing other more respectful words to use in our daily discussions. We want to use person-first language, which means not labeling someone by their diagnosis. We wouldn't refer to someone with cancer as cancerous, but someone with cancer. It is the same with mental health issues. We don't call someone a schizophrenic, but rather someone with schizophrenia. We may feel that saying someone suffers from a mental illness is compassionate. However, the term can be stigmatizing, and we don't know how someone perceives their illness. There are various types of categories of mental health disorders someone may experience. They can all be found in a book called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. Mental illnesses are characterized by changes in our thinking, mood, or behavior. There is also often distress and difficulty functioning in one's life. This is the guide that mental health professionals use to diagnose someone with a mental health disorder. These are some of the more common types of mental illnesses. Mood disorders, such as major depression or bipolar disorder, may impact how you feel. Anxiety disorders can cause significant worries and fears, not based on an actual threat or danger. Schizophrenia can cause unsettling thoughts, delusions, or hallucinations. Personality disorders may result in unhealthy patterns of thinking, functioning, and behaving. Eating disorders, such as anorexia nervosa or bulimia nervosa, influence eating behaviors accompanied by negative thoughts about body, shape, and weight. Problem gambling occurs when a person can't stop gambling, even when there are many negative impacts on their life. For example, spending too much money, arguments with family or friends, avoiding work or school or other activities. Substance-related disorders can be divided into two categories: dependence on substances, needing a substance to function, and substance-induced disorders, mental health disorders brought on by using substances. Suicide is a complex issue. Not all people who die by suicide have been diagnosed with a mental illness, and not all people with a mental illness attempt to end their lives by suicide. There is still a lot of stigma around the topic of suicide. Shame may prevent people from seeking out support or talking to someone about their thoughts of suicide. People who are thinking about suicide are often in a great deal of emotional pain. They may feel overwhelmed, helpless, and hopeless. They may feel shame for thinking this way and feel as if others would be better off without them. There are many factors that may cause someone to want to end their own life. It's often a combination of factors rather than just one thing. Elements such as loss, addictions, trauma, depression, serious physical illness, and major life changes can make some people feel overwhelmed and unable to cope. It is important to remember that it isn't necessarily the nature of the situation that is as important, but how that individual interprets it. What one person may feel is unbearable may seem manageable to someone else. Suicide can be prevented. Many people may not want to ask someone about suicide, as they worry that they may put the idea in their head. That is a myth. Talking about suicide will not cause someone to have thoughts of suicide. By asking the question, it shows that you care and are a support. There are a variety of resources that are available to help someone who may be experiencing thoughts of suicide, as well as helping us learn how to help. For example, call or text 988 to access the Suicide Crisis Helpline. It can be difficult to determine how many Canadians are impacted by mental health challenges. Statistics can vary. Not everyone who has a mental health issue sees a mental health professional. Some people have more than one mental health concern. Based on this information, it's fair to say that mental health problems are very common. People can experience a physical health issue as well as a mental health concern at the same time. Depression as well as cancer. This is often referred to as comorbidity. It is also common for someone to have more than one mental health challenge at a time. For example, someone may have a diagnosis of anxiety as well as a substance use disorder. We will talk more about co-occurring mental health challenges and substance use in the next part. The term co-occurring disorder describes when a person has both a mental health challenge and a substance use issue or behavioral addiction, such as gambling, at the same time. An example of a co-occurring disorder would be a person having both an alcohol use disorder and be diagnosed with depression. You may also hear co-occurring disorders called concurrent disorders, comorbid disorders, dual disorders, and dual diagnosis. Let's look at some examples of co-occurring relationships next. Mental health challenges in combination with a substance use issue or behavioral addiction can impact each other in different ways. According to the Center for Addiction and Mental Health and the Substance Abuse and Mental Health Services Administration, Substance use can make mental health issues worse. For example, cocaine use can make you feel more anxious and increase unwanted thoughts. Use of cocaine can also lead to taking more risks. This could result in spending more money than you wanted while gambling. Symptoms of one problem can look like the other. For example, the symptoms of long-term methamphetamine use can look like a mental health symptom called psychosis. Substance use can hide the symptoms of a mental health issue. For example, alcohol use can hide social anxiety symptoms. One issue may cause development of the other. For example, the risk of developing psychosis is greater if cannabis use is started at an early age. Additionally, sometimes people use substances to stop thinking about their mental health issues. Some substances can make mental health medications not work as well. Using substances can make people forget to take their medications. To make an informed decision about using substances, it is important to understand the impact they can have on your mental health. We can all likely list several strategies that can improve our physical health and reduce the likelihood of developing physical health concerns. Chances are, we may not be able to do the same for our mental health. Do we know what we can do to take care of our mental health and reduce the likelihood of developing mental health issues? The Canadian Mental Health Association recommends developing healthy self-esteem. This is having an awareness of and accepting our own individual strengths and challenges. Establish positive support networks by making time for friends, family, or supports in your life. People in our networks can offer us various types of support. Getting involved in your community can help in feeling a sense of purpose and be a way to meet new people. Resiliency refers to how we cope with stress and difficult situations that are in our life. There are things we can do to help us deal with challenging situations more effectively. For example, trying to prioritize getting enough sleep, trying to eat a balanced diet with enough fluids, and exercising regularly. Recognizing and acknowledging both our positive and negative emotions. Connecting with our spiritual well-being involves getting to know ourselves and what is important to us. Why do some people experience mental health challenges and others don't? There is not one single cause of mental health or co-occurring problems. There may be a variety of factors which can increase the likelihood that someone may develop a mental health problem in their life. We will discuss this more next. Certain groups of people may experience mental health issues at a higher rate than others. People that have both a mental health challenge and a substance use issue have a greater chance of negative health outcomes versus those that only have one issue. Some of these negative impacts include shame, guilt, stigma, more visits to the hospital, violence, housing instability, and serious health conditions. According to the World Health Organization, the social determinants of health are non-medical factors that influence a person's health. They are the conditions in which people are born, grow, work, live, and age. They can either have a positive or negative impact on someone's overall health, depending on their access to resources and support. Some examples include health services, where someone lives may impact their ability to access the healthcare services they need. Biology and genetic makeup. There can be a greater likelihood of developing some mental health and co-occurring disorders if you have a parent or family member who has one. Healthy child development. Experiencing a traumatic incident in childhood can make it more likely that someone may develop a mental health or substance use disorder later in their life. We will discuss how adverse childhood experiences can impact many different areas of a person's life next. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur in childhood between the ages of 0 and 17. ACEs may increase the development of physical health problems, mental health challenges, and/or substance use. Some examples of ACEs include experiencing violence, abuse, or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide. Growing up in a household with substance use issues, mental health problems, parental separation, or household members being in jail can lower a child's sense of safety, stability, and bonding. Please note that these examples are not a complete list of adverse experiences. Many other traumatic experiences could impact health and well-being, such as not having enough food to eat, experiencing homelessness or unstable housing, or experiencing discrimination. Now that we know more about the impact that adverse childhood experiences can have on someone's life, what steps can be taken to decrease the risk? Some examples include, as a parent or caregiver, ensure your child gets a strong start with quality childcare and preschool activities that involve your family. Look for resources on how to teach your children and teens skills for handling stress, managing difficult emotions, and fostering healthy relationships. Help your child connect with other supportive adults and engaging activities through mentoring and after-school programs. There are many factors that may impact if someone seeks out professional or informal supports with their mental health issue. It may be difficult to navigate the healthcare system and know where to go. Depending on where you live, there may be varying amounts of supports available for mental health and substance use issues. Waiting lists can be long, which can be frustrating. Someone may not seek out support because they don't want anyone to find out that they are experiencing a mental health concern. There can be costs involved for certain treatments that people aren't able to afford. At times, someone may not recognize that they are experiencing a mental health issue. They may have felt this way for so long that it feels as if this is normal for them. Most mental illnesses can be effectively treated by health professionals and community-based services. However, some people may need hospitalization to stabilize their symptoms. Unfortunately, because of the stigma of mental illness, many people avoid or delay treatment. Professional supports may involve a family doctor, psychologist, mental health nurse, community mental health worker, or social worker. There are medications that may be prescribed by a professional to help with the symptoms. Self-help treatments can involve talking with someone who has also experienced the illness, learning skills to deal with symptoms, ensuring we are eating well, getting enough rest, incorporating physical activity into our day where possible. There are skills that can be learned to manage stress, change negative thinking patterns into more positive ones, and build on your own individual strengths. These can help when dealing with mental health issues. Psychotherapy, also known as talk therapy or counseling, psychotherapy is provided in a safe and confidential environment that allows the person to explore and understand feelings and behaviors and gain problem-solving and coping skills. It can be offered in a variety of formats, including individual, group, couple, and family sessions. There are a variety of treatments that are effective for both substance use and mental health issues. Some are helpful for more than one mental health issue, and not every treatment may be effective for everyone. A combination of medication and other forms of treatment, for example, counseling or self-help, are often recommended to improve a person's mental health. According to the Center for Addiction and Mental Health, when a person receives prompt treatment for co-occurring mental health and substance use problems, there are much greater hopes for recovery. However, stigma can discourage families from seeking care and support. Supporting a family member or friend living with a co-occurring issue can cause feelings of stress, anger, sadness, and worry. These feelings are natural, and many other families and friends feel the same way. As a support person of an individual with a co-occurring disorder, you may need to advocate on behalf of the person. You might need to educate others to help them understand co-occurring disorders. You may have negative feelings sometimes, and that's okay. You need to look after your own emotional, physical, and social needs. Please reach out to family, friends, healthcare professionals, and support groups. Remember that you are a part of a team of supports that includes healthcare professionals, peer supports, friends, and family members. You are not alone. Coping with both a mental health and substance use concern can be overwhelming and seem like an impossible task. Having a strong support system that provides empathy, understanding, and hope will have a positive impact on the person's long-term recovery. It can be difficult to know what to say or do when someone is experiencing a mental health issue. We may be worried that we will do or say the wrong thing. We don't want to make the situation worse, so we may not say anything at all. Showing kindness, compassion, and support to someone experiencing a mental health issue can have a huge impact. When someone is experiencing a physical health issue, we may call, send flowers, or invite them over for coffee. We can also do these things when someone is experiencing an issue with their mental health. People can and do recover from mental health and substance use issues. There are a variety of treatments available that can help people manage their symptoms and live full, meaningful lives. We hope that you are now able to define mental health and recognize the impact of mental health challenges when substance use is involved, understand the significance of stigmas and myths surrounding mental health, become familiar with common mental health disorders and co-occurring disorders, develop an understanding of mental health treatments and recovery supports, and have a greater awareness of mental health resources available. If you would like to learn more about mental health and substance use issues, there are a variety of resources that you can explore. Please check out the link shown here to the Shared Health Mental Health and Addictions resource page to learn more about accessing mental health and addiction services for all Manitobans, regardless of their age. Thank you for viewing this presentation, and we hope that you have found this information helpful.